everyone, this is Marika and I'm here today with a new topic of nursing management. I welcome you all to this new session, and in this session today we are going to discuss a very interesting topic, which is nursing care responsibilities and patient assignment. Now before we move on and see in detail what is patient assignment, how patients are assigned, what are the different methods that are followed in order to provide the nursing care, first we have to understand some of the basic things such as the responsibilities that are carried out by the nurses in the ward and also certain functions that a nurse carries out within the ward. So before we move on to today's topic, which is case method, we have to first understand few of the basic things such as the responsibilities that are carried out by the nurses, and then we will see the different methods that are used for providing the nursing care or for carrying out the roles and responsibilities within the ward. So we are already aware that the nurse in charge of the ward is the person who's responsible for all the activities that are carried out in the ward. So as a nurse in charge, the nurse in charge must not only be aware about what nursing professionals are doing within the ward, what activities they are carrying out within the ward, but she should also know the activities that other medical professionals as well as grade 4 workers are carrying out for maintenance of the ward and for the patient's satisfaction. So all in all, we can say that the nurse in charge is a key person within the ward to manage the ward, and she is the person who also coordinates with other people within the ward in order to provide a proper quality care to the patient. So here the nursing in charge of the ward also supports the other services that is taking place within the ward. For example, in case of emergencies, the physicians who are treating the patient may tell the nurse to carry out certain activities which the physician is responsible for. Certain therapeutic measures that are to be carried out by the physicians, in some cases in times of emergency, the physician may tell the nurse to carry out those activities. Similarly, like that, even in the absence of dietitian or in case of emergencies, the dietitian may ask the nurse to take over his or her responsibilities. From this example, we can understand that the nurse in charge will not only carry out or look after the nursing activities, but sometimes may also have to coordinate with the other people working within the same ward and may have to take up their responsibilities as well. We also have to understand that there are several defined functions that a nurse must carry out. Let us see one by one what are the roles and responsibility that a nurse is expected to perform. The first role and responsibility of a nurse may include those activities dealing with maintaining a safe and a proper environment for the patient and protecting the patient from any kind of mental or physical harm, and providing the maximum physical and mental comfort for the patient. So here we can understand that the nurse may carry out any activity that deals with the organization and control of the patient's environment, and she is also responsible for providing physical as well as mental comfort for the patient. The second major responsibility of a nurse is concerning the immediate personal care of the patient. We know that nursing care involves the personal care of the patient. So whatever personal care the patient requires, the nurse is the person who is responsible for providing the immediate personal care to the patients. The next roles and responsibility of a nurse includes the activities that is to be performed under the direction or in collaboration with the physicians. So we know that as a nurse, we work with the physicians in the same ward, and those kind of activities are to be performed by the nurse under the direction of the physician or with the cooperation and coordination with the physician. And finally, the nurse is also responsible for the administrative duties of ward and its management. So these are the basic functions of the nurse under which several different activities are carried out. Now we are going to discuss the different methods that are followed in the hospital by the nurses in order to render the nursing care. The first one that we have is case method. Case method is one of the oldest method of organizing the patient care. Now let us see how are nurses assigned with the patient in case method and what are the various roles and responsibilities that they carry out. In case method, we have to understand that one single nurse will be assigned with a particular patient. For example, example, one single nurse will be assigned with 1 or 2 patients, and it depends on the amount of time that the nurse has to invest on each of the patient. Now, this may differ sometime from 1 patient to 2 patients to 3 patients. A single nurse will be assigned with a particular patient, and the nurse herself has to take the sole responsibility for meeting all the healthcare needs of the patient. We are already aware that nurses work in different shifts. The particular period of time, the certain period of time that a nurse works within the hospital is called as a shift. So during the shift, the nurse herself is responsible for meeting all the health needs of the patient, which means she has to take care of the medication, the basic care that the patient needs, the daily routine activities that is to be carried out for the patient, the treatment, medical administration, etc. So whatever is to be done for the patient to meet the need of the patient, the nurse has to take the entire responsibility. Let us now try to understand the approach used in case method. So as I told, the case method is one of the oldest method of organizing the patient care, and it is still used in certain hospitals and healthcare agencies. Specialty units such as ICU or ICCU usually use this model in order to organize the patient care or in order to render the quality nursing care to the patient. So here we understand that a single nurse is assigned with a particular patient, and she is responsible to meet all the nursing needs of the patient. So here we see that a holistic care is being provided to the patient. Usually the interruption in the care that is being provided to the patient is not seen in case method. Case method nursing care also provides the nurses with high autonomy as well as responsibility. As I told, a single nurse will be assigned with a single patient or 2 patients in order to take care of the patient, and she is responsible to meet all the needs of the patient. Therefore, there will be higher autonomy as well as responsibilities that will be carried out by the nurses. Another important thing that we should know is that case method is simple and it is direct. The line of authority, the autonomy is also very clear for the nurses. The nurse knows that she is responsible for the patient and she is responsible for all the activities to be carried out for the patient. Therefore, the authority and the autonomy is simple, clear, and direct. So here in this method, we can also see that the patient receives an unfragmented care from the nurses. So during the time of the nurse's duty or during her shift, the nurse provides a proper care to the particular patient, and the care that the patient receives is unfragmented. Because the patient is receiving care from one single nurse, the nurse is aware about all the needs of the patient, and the nurse herself is carrying out all the activities to meet those needs. However, there will be different nurses working for different shifts during a particular day, but still there will be only 3 different nurses responsible for the morning care, for the afternoon care, as well as for the night care of the patient. And we can say that the patient receives a holistic care through this approach. So moving on, let us see nurse as a case manager. Here the nurse is following the case method and she acts as a case manager. Therefore, the first thing that we see in a nurse is that the nurse is patient oriented and as well as outcome focused, which means the nurse focuses on one single patient, provides all the necessary care to the patient, and also meets the need of the patient. The second thing that a nurse does as a case manager is the collaboration with other health team member. As the nurse herself is responsible for meeting all the healthcare needs of the patient, the nurse also collaborates with the other team members to make sure that the patient's healthcare needs are met. The third responsibility that is carried out by the nurse manager is frequent communication or coordination with the patient as well as the other health team members. Now here the nurse has to understand the healthcare needs of the patient. The nurse also has to understand the problem that the patient is facing. Therefore, it is necessary for the nurse to communicate and constantly interact with the patient to maintain a rapport with the patient as well as to provide a satisfactory care to the patient. The second thing that the nurse has to do is also coordination and communication with the health team member to make them understand the health needs of the patient and also to see what activities are being carried out by other health team members to meet the goal. Another important thing that a nurse as a case manager does is taking care of the patient from the time of admission to the time of discharge. So as a nurse manager, the nurse coordinates the entire activities of the patient from the time of admission of the patient until the patient is discharged. The next responsibility that is carried out by the nurse as a case manager is the implementation of the plan. As the nurse is responsible for meeting the health needs of the patient, the plan is to be implemented properly by the nurse. Therefore, it is a responsibility of the case manager to see that the plan is implemented and also to monitor the progress of the patient towards the directed outcome. So obviously, the care is being provided to the patient because the nurse has a certain goal to meet. Therefore, it is the responsibility of the nurse as a case manager to implement the plan, not just implement the plan, but also to monitor the progress of the patient towards the desired outcome. The next responsibility of a nurse as a case manager as well as the other healthcare worker is to decrease the stay of the patient in hospital. So here the nurse, the healthcare workers such as doctors, the grade 4 workers who are working to maintain the ward, all of them are working towards providing a proper care to the patient, towards providing a proper environment in which the patient's recovery is enhanced. So here we can see that the nurse and also other healthcare worker as well as grade 4 worker are working towards decreasing the length of hospital stay of the patient. And finally, the last goal of nurse manager is to prevent the readmission of the patient, which means the nurse must be responsible, must provide a standardized care to the patient to meet the health needs of the patient so that the patient does not fall sick again and takes a readmission in the hospital. So these are the major goals of a nurse as a case manager. Moving on, let us see the advantages and disadvantages of case method. So the first advantage says that the care that is being provided to the patient is unfragmented. The second advantage of case method or being a case manager is that the case management process itself is an autonomous role wherein the nurses requires proper decision-making skills as well as the nurse has to be a clinical expert, which means she should have adequate knowledge on how to manage the patient. Another important advantage of case method or case management is that it helps to provide a well-coordinated care to the patient, which will in turn help to decrease the length of hospital stay and services efficiently to improve the care that is being rendered to the patient. And finally, the last advantage of case management is that for the patient who comes to the hospital with complex health problem, a comprehensive care can be provided to such kind of patients. Moving on, let us see the disadvantages of case method. The first disadvantage is that the greatest disadvantage of case method comes when the nurse is not properly prepared to provide the care to the patient. So we see that sometimes the nurses may not be adequately trained, and therefore when the nurses are not properly trained, they will not be able to meet all the health needs of the patient. If only one nurse is responsible for taking care of the patient entirely, and if the nurse is inadequately trained, then that can be a problem. It may affect the quality of care that is being rendered to the patient. And the next disadvantage is that if the non-healthcare professionals are to be utilized effectively within the ward, then this method can be altered. So we can also see that in a ward there will be non-professional workers who work towards the same goal. Now, when we have to use the non-professional workers efficiently, then the case method may be altered. So these are the two major disadvantages of case method. So this brings us to the end of today's topic. In this session today, we have discussed one of the oldest method of organizing the patient care, which is called as case method. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day ahead.